when you get your peptides from us, we're going to go over this with you, but this is also something you can refer back to. When you order the peptides, you're going to get this kind of setup right here that I've got laid out, and I'm just going to go over it with you. You're going to get your actual peptides. They're going to be in a little plastic container like this. You're going to get some syringes, a couple bags of syringes like these. These are going to be what you inject your peptides with. You're going to get a card that's got your specific peptide, and it's going to have your dosage that you're going to be doing with some information on how to reconstitute it and stuff like that. And then you're going to get a bag with all your alcohol. You're going to get your reconstitution fluid that's already drawn up to however much needs to go in, and a needle to inject your fluid with. So I'm just going to kind of show you. When you get the peptide, take this, you'll pop the top off of the peptide and throw all this away. You're going to take your pre-dosed syringe here that's got the amount of fluid you need, one of the alcohols, wipe off the top of your peptide bottle. This is a needle to dilute your peptides with. This is not meant for injecting any of the peptides in. Please do not do that. You'll take this out of here, take the top off, twist it together. Now you can take this off. You'll see this needle is pretty big. You're going to put the needle into the top of the plunger here. It draws in the fluid all by itself. Swirl your peptide. Don't shake it. Don't rock it. You just need to swirl it just a little. Now you're ready. Every dose is in here that you need. This needs to be refrigerated after you've reconstituted it. So when you're ready to draw up your dose, you're going to get one of your syringes out of the bag like this, pull the back off. Now you're going to draw up on the syringe here. I'm going to get a little closer. Each big line is 10 units. Each medium line is 5. Each tiny line is a single. So if you're going to draw up 10, you're going to draw up to there. Today we're going to draw up 6, so we're going to draw up to there, which is one line beneath that medium line. So you're going to take the top off of yours, clean off your peptide, turn it upside down, put your needle into the middle of that bottle. I usually draw way past how much I'm going to need. Push the air out. If you have a little bit of air in there, you're fine. And I'm going to 6. So the top of my stopper is going to be at that 6 side. So now you're going to inject. So you're going to pull the top off, use an alcohol into the fat anywhere. Most people use their stomach. You're just going to grab your stomach, wipe off with your alcohol. Straight in, 1, 2, 3. Release, and then push in your peptide. And that's it. You don't need a Band-Aid. There shouldn't be any blood. You can do this yourself. If you can't do it, you can always come in and we can help you with that. That's how you reconstitute, draw up, and deliver your peptides.